you for your work. I have a question. It seems like healthy people are the greatest resource we have in this state. Can you, with your, just describe to us, if you have any numbers, if people were able to get the health care that they needed, the state would be more prosperous, we'd have a better economy. Kind of take us through the impacts of a lack of health care on the state and on people's ability to work.
Who wants it?
I think we can all touch different parts of that elephant. I don't know that any of us can answer all of it. So I will say that when New Hampshire expanded Medicaid the first go-around, you saw a dramatic reduction in the amount of uninsured people coming to the emergency department for care, right? Which means that they are going to their primary care provider, or they're coming to the ED and they have insurance. So that was a significant measurable difference when people have coverage. And Lori may know the statistics better than I do, but one of the populations in the Medicaid expansion population or services that there was a dramatic increase in was mental health disorders and substance use disorder services, because then they were covered and people are actually seeking treatment for that and then working and working. And so I think they're actually, it's more than anecdotal in that space. There's actually concrete information that we have that we can share.
I would say, underscore everything Matthew just said, right? The Medicaid expansion coverage alone brought in more than $3 billion into the state's economy in federal reimbursement in its first 5 years. When people get health insurance after they haven't been covered, they use their health insurance. They get checked out. They're like, oh, this thing's been bothering me for about 10 years, and that thing's been bothering me. And it's true. And the utilization goes up that first year. But the utilization has a payment stream, right? They come in and they get it all checked out, and they feel better because they're like, I feel better about going to the doctor because I know it can get paid for. People, honestly, for the most part, if they can't get paid for it, they don't want to go. That's why people wait until they're really acute when they're uninsured.
And they will get help, but they are in the emergency room in the highest cost center in the hospital getting that care that could have been a $100 service at a primary care agency instead of a $5,000 bill at an emergency room. And I mean, that is reality day in and day out. And in mental health, we see that in a variety of ways, between ER boarding, which is something that we've talked about in this state a lot, hundreds of people sitting in the emergency rooms waiting for a bed at New Hampshire Hospital. And then New Hampshire Hospital having 168 beds, and half of those beds are people in that hospital that can't find somewhere to go outside of the hospital. So it is just this constant cycle of just having enough access at the right level of care. So although I don't have a number for you, I think we can say that the longer people defer getting care, the more expensive care is.